Every single hour, more than 600 people around the world take their final breath because of smoking. Imagine that for a moment. 600 people every hour. By the time you finish watching this video, dozens of lives will have ended, families will have been torn apart, and futures will have been erased. It's like an invisible clock ticking away, where each tick marks another life lost. And the heartbreaking truth is that so many of these deaths could have been prevented if only the dangers were fully understood before it was too late. Most people think of smoking as just a bad habit, something dangerous in the long run but harmless in small amounts. You've probably heard someone say, "I only smoke socially," or "I can quit any time." Maybe you've even heard someone laugh it off, saying, "Life's short anyway." But what if I told you that the very first puff starts a chain reaction of damage that your body can feel in seconds, and the scars it leaves behind can last for years, or even a lifetime? Let's take a journey inside your body, inside your lungs, your bloodstream, your brain, and witness exactly what happens when you take that first drag of a cigarette. Picture this. You raise the cigarette to your lips, light it, and inhale. In that moment, over 7,000 chemicals rush into your lungs. Yes, 7,000. Among them are formaldehyde, the same chemical used to preserve dead bodies, arsenic, which is found in rat poison, and carbon monoxide, the deadly gas that can suffocate you silently in your sleep. And then there's nicotine, the star of the show when it comes to addiction, a compound so powerful that it rewires your brain in just moments. The smoke swirls into the delicate branches of your lungs, coating them with sticky tar. Your airways, which were once clear and ready to bring in fresh oxygen, begin to narrow and swell. Tiny hair-like structures called cilia, whose job is to sweep out dust and germs, get paralyzed almost instantly. Without them, your lungs become vulnerable to every passing infection, every speck of pollution, every bacteria looking for a home. The damage begins with the very first cigarette, not the 100th, not the 1,000th. Within 10 seconds, nicotine enters your bloodstream and travels to your brain. Your heart rate spikes. Your blood vessels constrict, raising your blood pressure. The reward center of your brain floods with dopamine, the feel-good chemical that tells you to do it again. And so, the cycle begins. Each puff strengthens the craving. Each cigarette deepens the dependence. The brain starts associating smoking with relief, calmness, or focus, even though it's the cigarette itself that caused the discomfort it's now relieving. But the real danger of smoking is how silently it attacks. While you go about your day, those chemicals are at work in the background. Carbon monoxide latches onto your red blood cells, stealing the space where oxygen should be. Your organs, especially your heart, are forced to work harder to make up for the missing oxygen. Over time, the lining of your blood vessels becomes rough and sticky, a perfect trap for cholesterol and fat, leading to dangerous blockages. That's how heart attacks and strokes take root, slowly, quietly, until one day, without warning, everything changes. And then there's the cancer risk. Smoking doesn't just affect your lungs. It can cause cancer almost anywhere in your body: your mouth, throat, esophagus, stomach, pancreas, bladder, even your blood. The tar in cigarette smoke is a sticky cocktail of cancer-causing agents that damages your DNA, the very blueprint of life inside your cells. Damaged DNA can mutate, turning healthy cells into deadly tumors. And here's the truth: there is no safe level of smoking. Even one cigarette a day increases your risk of heart disease, lung disease, and cancer. Let's go back to the lungs, because that's where the most visible devastation happens. Imagine the healthy lung of a non-smoker, light pink, soft, and springy, ready to expand and contract with each breath. Now picture the lung of a long-term smoker, blackened with tar, riddled with holes from emphysema, stiff and scarred. When you try to breathe through lungs like these, every inhale feels like you're trying to suck air through a narrow straw. And when your body can't get enough oxygen, every part of you suffers: your brain, your muscles, even your skin. And it's not just the inside of your body. Smoking leaves its mark on your appearance too. It breaks down collagen, the protein that keeps your skin firm and youthful. Over time, wrinkles deepen, skin sags, and your complexion becomes dull and uneven. The chemicals stain your teeth and nails, your lips darken, and the constant exposure to heat and smoke can thin your hair. The smell of stale smoke clings to clothes, hair, furniture, sometimes so strongly that it lingers for days. It's not just about living less, it's about living with these visible reminders of damage. Some people think that vaping is a safer alternative, but studies show that vaping can also deliver harmful chemicals to your lungs and bloodstream. Many vape liquids contain nicotine and other toxic substances that irritate the lungs and can cause long-term harm. The truth is, your lungs were designed for one thing: clean air. Every time you inhale something else, you're asking your body to fight an unnecessary battle. Now, I want you to think about someone you care about: a parent, a sibling, a friend, someone who smokes. Imagine their heart struggling to pump blood through narrowed arteries. Imagine their lungs gasping for air after walking just a few steps. Imagine them hooked up to oxygen tubes just to survive another day. This isn't just a statistic. It's a reality for millions of families around the world, and for those who've watched a loved one battle lung cancer, emphysema, or a heart attack caused by smoking, the scars go far beyond the physical. But here's the part that should give you hope. Your body is incredibly resilient. The moment you stop smoking, the healing begins. Within just 20 minutes, your heart rate and blood pressure drop. After 12 hours, carbon monoxide levels in your blood return to normal. Within weeks, your circulation improves and your lung function starts to recover. After months, your lungs are cleaner, you cough less, and you have more energy. And after a few years, your risk of heart disease and stroke drops dramatically. Even your cancer risk begins to fall. It's never too late to quit, and every single day without a cigarette is a victory for your health. Yes, quitting is hard. Nicotine is one of the most addictive substances on the planet. It changes the chemistry of your brain, creating withdrawal symptoms that make it feel impossible to stop. But millions have done it, and so can you. You don't have to do it alone. There are resources, communities, and people who care about your health and your future. That's what we're here for. We share this knowledge, these truths, not to scare you, but to stand beside you, to help you make the choice that could save your life. So the next time you see someone light a cigarette, or the next time you're tempted yourself, remember this journey inside the body. Remember the cilia that stop sweeping, the tar that sticks, the blood vessels that tighten, the DNA that mutates. Remember the faces of those who've lost their battle with smoking-related disease. And remember that every cigarette is a step toward a reality you don't want. We can't change the past, but we can change today. And today could be the day you take the first step toward healing, toward breathing freely, toward living the life you were meant to live. The decision is yours, but you're not walking this road alone. We're here, sharing the science, the stories, the hope, to remind you that you are worth it, that you matter, and that your future can still be smoke-free.